brass quintet will be playing each service song, and we will recognize each group. So, to start things off, the Army, please stand. Next up, the Marines. Next, the Navy. Air Force. And last but not least, the Coast Guard. Post the colors. I'm going to turn the program over to Jim McLean, the Deputy Director of our Milwaukee VA Medical Center, who will frame our program. Take it away, Jim.
Thank you, President Joanne. It is a great pleasure for me to introduce Dr. Daniel Zomchek. primarily because he's my boss, so I need to sound like I'm very pleased, but I truly am. Dr. Zomchek is a graduate of Bowling Green University as well as Loyola University in Chicago. He's been with the VA for 14 years and has been the director at the Milwaukee VA Medical Center since 2016. He has truly had rapid advancement in the VA. He started off as a staff psychologist and the assistant chief at the Jesse Brown VA Medical Center in Chicago. I think one way I would truly describe Dan as connected and based to the community. His family ran Zomchek's Deli on North Avenue here in Milwaukee for many, many years. In fact, Dr. Zomchek really was very proud to come back to Milwaukee and renew that connection. He is incredibly connected to the mission of the VA and service to our veterans. In talking to Dan, what you'll hear time and time again is, our mission is to care for our vets, and we're going to do that with all our heart. He's also connected to the Rotary. Dan is a recipient of a Rotary scholarship when he was in undergraduate school, and he is especially connected with his family. His wife, Jen, he's a devoted husband to, and his son, Braden, he is an incredibly proud father of. With that, it is my pleasure to introduce Dr. Daniel Zomchek.
All right, well, happy Tuesday, everyone. Thank you so much for having me, first of all. I can't tell you how much of a pleasure and honor it is for me to be standing in front of you all. And I want to actually start off by publicly recognizing Jim McLean. He is, talk about service above self, and what he has done in serving our country and what he does now in serving our veterans. Most recently, he has stepped into my role in an interim basis when I was asked to cover at the Lovell Federal Healthcare Center in North Chicago for a few months. He's now serving as the medical center director on an interim basis in Milwaukee. So I'm sure there will be wonderful things that happen over the next 90 days that cannot be credited to me. So thank you very much, Jim. Okay, so I get to talk about the Milwaukee VA or the Zablocki VA. So just to frame this a little bit, we have the honor of getting to take care of our nation's heroes, right? So our coverage area is essentially the eastern side of the state of Wisconsin. We get to take care of about 64,000 veterans in totality across the system. Our kind of scope ranges all the way up to from Green Bay, which is a gorgeous 160,000 square foot healthcare center, and spans all the way down to our outpatient clinic in Union Grove. The home base, as it were, is here in Milwaukee. We are the most complex category type that VA has. We have about 150 hospital systems throughout the country, and there's about 35 of us that are the most complex category that we rate them. And so there really isn't too much that we don't provide. Robotic surgery, we have specialty programs like spinal cord injury, primary, secondary, tertiary care, I'll go into it in a little bit. We have a little over 4,000 FTE, about a $600 million operating budget every year, close to 500 beds that span acute and long-term care and so forth. So again, there's not too much that we don't get to provide. One of the things I like to talk about is how folks know mostly about our clinical mission, but really we have four missions that really work together in unison to provide great care for our nation's heroes. First off is education and training. You may know that 70% of the nation's physicians have had at least some of their training in VA. across the country. And I'm not much different. I'm not a physician by background, but I came into the VA as a psychology intern prior to me getting my PhD. And I didn't know much about the VA until I learned, and have just had a grown passion for what we get to do. So education-wise, though, in Milwaukee, we have 124 affiliations across 54 different healthcare fields. So incredible, right? Lots of residents, almost 400 residents rotate through. We have a lot of nursing development programs. We really don't have a hard time recruiting nurses, in large part, I think, because of our mission and because of this infrastructure that we have built, training program-wise. One thing I want to highlight is that we have a closer connection with our academic affiliate than any other VA that I've ever worked in. And I've worked in numerous networks and numerous VA facilities. Everyone is paired with a local academic affiliate for training and education. Our partnership with the Medical College of Wisconsin is really second to none, and Freighter. So it's really the same physicians that are taking care of our veterans that are taking care of patients at Freighter for the most part. We did some research for the dean not too long ago and found that 98% of our medical and surgical specialists in Milwaukee that take care of our veterans are MCW physicians. And I also want to do a shout out for MCWs. They had a strategic vision to create a new medical school and a psychiatry residency program on top of that up in Green Bay and Wausau. And in Green Bay, as all health systems do, we have a hard time recruiting psychiatrists in non-urban areas. But I tell you, this is a game changer. Our partnership with them, we are going through our first class, residency class now, and we know based on the literature that physicians tend to practice where they train. And so I anticipate that we're going to have a really nice flow or feeder system of psychiatry services to provide our veterans up in the Green Bay area for years to come. Research. So this is another key component underpinning of what we do. So we have about a $10 million program every year in funding. A couple of unique research-based projects that you may not know about is we are one of the few participants in the country in our A Million Veterans program. And what that essentially is it's genome research, essentially. We're putting a data bank together of the DNA, essentially, of lots and lots of veterans so that we can study illnesses, particularly rare illnesses. So this will be really the largest bank for which to do research. We have about 700,000 patients right now in the database. And this is another example, I think, of how research that the VA does helps not only veterans, but it helps the community at large. We've seen this with, the VA created or invented the nicotine patch. A nurse invented the Barcode medication administration. So on inpatient, the notion that we would scan the barcode of a wristband of a patient and then scan it to the medication bottle before the drawer would open and we'd be allowed to dispense that medicine, just to help control for human error. This no doubt has saved lives. Crash lab. So we have a crash lab on our campus. A lot of folks don't know that. This is, again, a partnership with the Medical College of Wisconsin. We're the only NHTSA certified crash lab in an academic setting in the world. And it really is. It's a big, long building, and we get to crash vehicles. That's what they do. And they do some work on new automobiles for automobile companies, but really the bread and butter of what we do there is do research on how seatbelts and airbags can be better fine-tuned. And in fact, there's been several new laws and guidelines for automakers that have come out of the research that has been done right here at our Milwaukee campus. Emergency preparedness. So we are a national resource for the American public in cases of disaster. So this is a picture of in Puerto Rico after the hurricane, and we, not unlike other facilities, deployed our staff to rotate to provide services to those folks in the disaster zone. So we had a physician who was on a mobile medical unit. We had a police officer who was deployed, social worker, et cetera. And then, of course, clinical. And there's a few bullet points that I thought would be important to talk about what we provide that may be different from other healthcare organizations. One is you see the underpinning of our clinical services really is it's really based on its evidence, right? On research, what we learn from training and education, it's evidence-based. So for example, we have a mental health intensive case management program where we have, it's a very resource-intensive program where we have social workers, nurses, other staff that go out to the homes of our seriously mentally ill veterans with schizophrenia, bipolar, et cetera. Because in order to make sure their home-like environment is stable, taking their medications, et cetera. And what that has done is prevented them from having to come back to inpatient psychiatry, the inpatient psych unit. So what this essentially is the trifecta, right, of what we're working on in healthcare. It's prevention, and it's higher quality, because patients don't have to be admitted into the inpatient psych unit. It's higher patient satisfaction. They love this program. And it's lower cost. Even though it's resource intensive, it's a lot more cost effective than utilizing inpatient psychiatry beds. Another point I wanted to mention was how we are fundamentally incentivized to prevent healthcare problems. Our whole funding model, we get to keep our patients, right, if they let us, throughout their entire life, right? So we're incentivized to put programs together that will prevent hospital admissions, that will prevent folks from getting sick. So one program that we're getting early results on right now is essentially it's PIM, it's essentially primary care intensive management program, where we are targeting folks who have been admitted for congestive heart failure exacerbations, which is a pretty routine reason for being admitted to the hospital. And we're doing a similar model where we're going out to their home and helping them with their environment, hooking them up with other services that they're eligible for through the VA or in the community. And we're finding some early results already that is preventing admissions. And then lastly, I would say continuum of care. So we get to provide, you'll see in terms of like the types of beds, we have, of course, acute med-surg beds and ICU beds, but it goes further than that. We have acute rehabilitation beds. We have long-term care, about 113 long-term care beds. We have residential treatment programs for substance abuse and mental health disorders like PTSD. Get back to work programs that we call compensated work therapy. That's, again, evidence-based. That helps people get back on their feet with some assistance, graduating them to more and more independent living situations. So inpatient and outpatient pharmacy, all within one comprehensive continuum of care. And I think that's different from a continuity of care standpoint, dealing with a lot of the same doctors. One of the videos that I wanted to show you is about suicide prevention. So this is our top clinical priority in VA. We know that 20 of our nation's veterans tragically decide to take their lives every day. And most of those folks aren't enrolled in VA healthcare. So one of community engagement is a huge priority of mine, and I think this is where I think we can all help, is recognizing oftentimes it's not the veteran, by the way, that is the trigger to come and seek help. It's a family member, a neighbor, a friend. And so the more we can get the word out about suicide prevention and some of the call signs for it, I think literally the more lives that we're going to get to save.
Good.
I'm good.
I'm good.
I'm good. But I have a story, and I don't know where to start.
I'm good. But I feel alone in a crowd.
I'm good. But nobody understands.
I'm good, but the past keeps coming back.
But I can't get out of bed.
But I can't sleep.
I'm good, but I feel overwhelmed.
I'm good, but I don't feel safe.
But I don't even know who I am anymore.
But I still have nightmares. But I don't need any help. I'm good, but I don't feel anything anymore.
I'm good, but I can't live like this anymore.
I'm really not so good. But are you ready to listen?
That video gets me every time. Okay, all right. Spinal cord injury. So this is one of our very specialized programs. We have a crazy, outstandingly great spinal cord injury program. This is a screenshot of our PT area. Dr. Lee is on the left-hand side. He's a veteran himself and our medical director, great guy. He has built a program that we are a national referral center for veterans with spinal cord injury. And no doubt he has built a program with the most amount of adaptive sports equipment and programming to help with recovery in the country, no doubt, certainly in VA. And it's really remarkable. We send folks to the Olympics. They win medals, gold, et cetera, medals. It's incredible what our veterans accomplish. Opioid reduction. So this is, we can't turn on the news but hear about opioid-related deaths, whether it's street drugs or prescription drugs. It seems like every other day, certainly in this city, in this state, and it's really a national problem. And so VA has taken this very seriously, and I'm very proud that since 2012, these data are showing through 18 that the blue line is a national VHA across the country, the average, and then the red line is your Milwaukee VA. And we've seen a 32% reduction in the number of our veterans that have been prescribed opiates. And the thing that we're finding through the research that drove us to do this is that patient reports of pain aren't higher, and their suffering is not higher. It's actually creating more independence for them. So we're very proud of that. Partnerships. Again, community engagement is a huge priority of mine, I've talked about. We cannot do what we do without volunteer organizations and without partnerships. You heard from Lincoln Avenue Stables. So that's a perfect example, right? Of we don't raise horses and we don't have horse farms, but we know that equestrian therapy for some of our veterans in dealing with post-traumatic stress disorder, depression, other illnesses is instrumental and a turning point for their lives. And so there are things that our community members can do to support our veterans that we can partner with, and that just helps our patients all the more. One other thing that we're doing in the top right picture is we're working with the West Dallas Fire Department, the paramedics we're essentially have an agreement with them where they'll go out to the homes of our veterans who tend to come back to our emergency department frequently. with the target of preventing them from having to do that, hooking them up with other services. Something as simple as having air conditioning, I'm told in the home of a patient with respiratory issues will be the solution so that they don't have to come into the ED. So we're very proud of partnerships that we've developed. GE and the Packers, of course, are the other two arenas. And I have to talk about our volunteers. We have incredibly benevolent volunteers. We have over 800 volunteers as of last fiscal year, donating over 120,000 hours of time. I mean, it's incredible, all the way from Green Bay down to Union Grove. This is a picture from last year. Dick Marbs is really a national leader in the Disabled American Veterans Organization. And he is not only a wonderful guy, he's a wonderful person, but we are celebrating almost 30 years of his dedicated service. So I want to talk a little bit about construction. We always have construction going on. It was like my way up here, from Lovell. It's like there's winter and construction, the two weather patterns, or seasons, I should say. So the Fisher House, we built this a few years ago, really because of the benevolence from Fisher House, Wisconsin. They have been an incredible partner, not only in helping us build this building, but in helping to maintain it. For those who don't know, this is essentially the Ronald McDonald House for veterans' family members. But folks essentially stay there for free as long as they meet distance criteria in order to support their loved one who needs long-term or midterm inpatient care. And again, we know from the research that the proximity, the involvement of family members in helping with recovery, speeds recovery, and increases patient satisfaction significantly. Parking. So you talk about access to care. Parking has been a real challenge on our campus for a number of years. And I have to credit Jim McLean and my predecessors for teeing this up and getting it funded. We opened both of our two new parking structures while I've been here over the last 2 years, but really the credit goes to my predecessors to put all that planning together. We of course have valet services for our veterans. That's not going to stop, but this has been a huge satisfier, not only in attracting employees, but of course for our veterans. We also remodeled our catheterization lab this last year. We just opened that a few months ago. And in the future, we have a lot of stuff going on, but I thought I'd mention two arenas that I'm excited about. One is a new urgent care building. We're ahead of schedule on that, so we're looking at completion in September. And greenhouses. So this is the new age, if you will, for long-term care, community living center model. It's a very much a home-like environment type of model. So we have 3 of these houses on our campus. We're activating the 3rd one this summer. And essentially it's the 10 rooms or private rooms on the perimeter of the building for long-term care patients. And in the middle is a huge kitchen. It's gorgeous. It smells like bakery, like Zomchek's bakery all day long. It's fantastic. And there's a fireplace, a big screen TV, dining room, and we really make it a home-like environment. So if you have an opportunity, we'd love to show you around. Of course, so we are incredibly historical. We were one of the first 3 VA medical centers in the country, starting with the Old Main, the original soldiers' home that started being built in 1867, finished in 69. We have an enhanced use lease agreement that we're working on with Alexander Company. To historically remodel 6 of these buildings, the ones noted there, some quarters and then our administration building, and of course our beacon is Old Main. And it's going to be remodeled in a historically significant way, but to also provide housing for about 100 homeless veterans or at-risk for homeless veterans. So this is perfect, right? Because it not only preserves our history, but these folks are going to need health care, probably more than the average veteran, and having them right there on campus is going to be instrumental. So I dug up an older picture. This is not the way the grounds look now. It's a lot more busy. But this is one of the original pictures that I was given. And I did want to do a dedicated shout out to this club because I'm told that you all have dedicated $50,000 towards this effort for the rebuild of the old soldiers' home. So a huge thank you on the VA's behalf. VA Beats and Eats, I want to do a quick announcement for that. We are going to have a community event, soiree, if you will, on July 14th. We'll have a car show, a classic car show, music bands, historical tours that have been incredibly popular in the past, by the way. So you get tickets, a fun run, walk, roll. Those of you who are aware of, back years ago, we had Reclaiming Our Heritage, where we had reenactments and so forth. And then that stopped for a little while. Last year, we lit up our 150th anniversary event. And got rained on, unfortunately, but this year I'm crossing my fingers and toes, so that won't happen. So this year we're calling it VA Beats and Eats. So please come out. You'll see more stuff on our Facebook page and our website on that. Which is a good segue because social media is a big deal for us in the way that we reach our veterans and our community. So we have an incredibly, probably the most active social media and certainly Facebook page amongst all of the VA facilities in the country. You can see this is a month period between March and April, which is a pretty typical month for us. And you can see we're reaching 55,000 folks, and we're particularly excited about our videos. We do a lot of videos, fun things. So that, for our videos, we hit about 32,000 people that viewed. I want to show you one in particular. We're having our annual mental health summit coming up, and this year we're focusing on African American veterans. And I wanted to show you a quick video teaser on that.
I was scared at first, of course, because that's everyone's first obstacle is to know about having a job when they get back home. So I ended up having a job at UWM because my sister used to work at UWM and she got me into UWM in admissions as a limited term employee. I was having some therapeutic moments by helping the students get their stuff together as far as records and so on that's here for them to go to school. But then I started noticing that I started getting more agitated and irritated to what is here, and I was having some issues. And then I finally met my wife in 2008. And she was telling me, hey, something's wrong with you. I'm like, no, it's not me. And then her and my mom both ganged up on me and told me I need to go see someone. So that's when I came to the VA as far as being seen for mental health. I was just getting so irritated with people, and my mom and my sister, my mom and my wife said, boy, if you don't take your butt in there, we can't help you anymore. So I said, okay. So I went in. So then I started using the cognitive processing therapy to help me reintegrate into society. I thought everyone didn't know what I was talking about except my military brothers and sisters. But in all actuality, it's an adjustment period for all of us, not just for me, but it's for my family too. They have to adjust just like I had to adjust to.
Fantastic. And actually, Mr. Cocroft is here, unbeknownst to me ahead of time. So if you don't mind helping me acknowledge him for his service. I love that video. It's so heartwarming. So with that, I just want to say it really is an honor getting to do what we do in public service, and particularly with our mission. I tell our employees we have the best mission in the world. So, but we can't do it alone. So thank you for being interested in us. Thank you for all of your support, and I would love to entertain a handful of questions if you would like. Thank you. Yes, sir. The work on the old main building, when does that start, or is it already on the way? I was asked to repeat. So not sure. My understanding is that there's still some additional fundraising that Alexander Company needs to do, which I can't be involved in, being in a federal entity. But I do know that there's, between the additional fundraising and there's some scoping with my chief engineer that needs to be done about water pipes and where all that stuff will go before it goes up to VACO. But I was told that the period of performance for the construction would be about a year. So their hope was that they would get it completed in 2019 for the 150th anniversary of it actually, being completed originally. Thanks. Yes, in the back. So the question was, are there other events other than our Christmas party event where folks come in and speak to our veterans? We have, yes, we have events, honestly, throughout the year, lots of events. I know this club, Rotary Club, has been there. The Umbra Club that I'm a member of has been there. We have an Alcoholics Anonymous meeting that's coming up that I'll be speaking at. That's in our main auditorium. It's the best way to be read in on that. I hate to do another plug for Facebook and our intranet site, but in all honesty, that's probably the best way to get the calendar of events of what's hot so that you can participate. Yes, thank you. Other questions? Yes, sir. Great. So folks have lobbied for the choice program, and so how would that impact the VA? So that's a great question and timely one. So to kind of correct a misnomer, us paying for care in the community, for VA paying for care in the community is not different. Well, it's different the way it's done, but we have always, since I've known, if we can't provide the care because it's specialized transplants or something, or we don't have a bed or whatnot, or we can't get someone in timely, we have for a long time sent care in the community. What's changed with the Choice Act is that it's being done differently with a different mechanism and a different funding source. So it has expanded. We will see what happens in terms of the new choice law if it becomes expanded more. I think at the end of the day, there's a lot of talk about privatization and such in terms of VA care as well. And I think ultimately our veterans are going to make decisions with their feet, right? Just like any organization. And so it's critical that we stay on the top of our game, that we do a great job. Do I think that there's a huge, immediate threat? I don't. In terms of Milwaukee VA, we have an incredible reputation. Folks before me, and hopefully I'm continuing doing some great work. But no doubt, we need to keep providing great care. Fortunately, I think this is what I tell our staff is whether we look at, there's evidence-based research studies done on health outcomes, whether it's mental health or inpatient care or whatnot. The abstract I could almost write myself. It pretty much says the same thing, that overall, that VA care is as good and oftentimes better than other healthcare organizations provide. So, but we need to stay on top of that game. We need to do more telehealth and do more progressive stuff in the future. Thank you. Yes, sir.
What percentage of the veterans in your service area are actually enrolled in VA? Do you have any idea?
That is a really good question. What percentage of our veterans in our catchment area are enrolled in the VA? So it varies by region. I'm thinking about this. And I know in our northern clinics up in Green Bay, it's higher. Across the country, it's in the low 30s%, I want to say. For us, it's a little higher. It's mid-upper 30s, I believe, is our average across our system. But then in the Appleton, Green Bay area, we are quite high. In some areas, we're approaching or around 50%. Yes. Yes, sir. Yeah. So the question was, do I have a cost average per patient for patients in the VA versus folks in the community as a comparator in terms of which one's more expensive? It's funny. It's funny. I have a team that's working on that, on getting me those numbers. I haven't seen them. I know financial stewardship is one of my top 3 priorities. You know, it's access to care, financial stewardship, and community engagement. And so, but when we look at cost per patient, I know Milwaukee VA is on the lower side relative to the VHA average, but I don't know how it compares to the community. And some of it, I will say, is, you know, by definition, being a federal public service, we are incredibly transparent, right? Anything that happens, we all have a right to know, a responsibility to know, you know, one might offer. Whereas those data are comparative data are oftentimes not as accessible outside of our organization. But that's a great follow-up. I will follow up on that. Yes, sir.
Mind the Sonic Lodge has a interaction, or what about combat injuries?
So what percent in spinal cord, I believe you're asking, of any veteran are related to combat-related injuries versus non-combat was the question, particularly involving spinal cord. So first of all, thank you. Who doesn't like pizza? But for all of your help. That's a good question. So the eligibility criteria, I don't know off the top of my head to answer your question. I know that really we have eligibility criteria are set up by our board of directors, Congress, and it ranges from folks that are service-connected, injured, you know, in the line of duty, all the way to other folks who it's kind of a sliding scale if they're in need, homeless and so forth. And so I would have to do some recon in terms of what the percentage is. But you're right, folks in spinal cord injury unit are not all injured in the military. It could be, you know, after their release, as long as they're eligible. Okay, well, thank you very much. I really appreciate the time.